last lecture is going to be about disorders of the brain function.
Admittedly, this is different than the spinal cord injuries, SCI, that we talked about last week. But it's still relevant insofar as
all the injuries are the same, or not the same, but similar causes. So we're going to be talking about mechanisms of brain injury, the trauma, hypoxia, excitatory amino acid injuries, and cerebral edema. You remember what edema is? Swelling, right? Fancy word for swelling. So yeah, a lot of this stuff. This is like we're starting to transition into lectures that like it's a lot of the repeated stuff just in different areas of the body. You kind of saw that last lecture. And the cystic fibrosis and the hormone stuff and stuff like that. Edema is no different. And we're going to talk about traumatic brain injury and Alzheimer's disease briefly before we end. But a lot of that's smoke and mirrors. I don't know. We'll get to that.
All right. So the mechanism of brain injury. There's a lot of things that cause brain injury, right? Trauma, strokes. I'm not going to read this. Oxygen deprivation, toxic exposure.
Brain damage resulting from these disorders involves several common pathways, including inflammation. Right. So we talked about that with spinal cord injuries. That like you can have a primary injury and then a secondary injury from inflammation because, you know, your immune system's responding to a small amount of a primary injury, and then it comes in, the immune system comes in and then does more damage as a secondary injury. Hypoxia, ischemia, edema, and excitotoxicity. And we're going to talk about each one of these. So the symptoms, just like with the spinal cord, these symptoms are dependent upon what areas of the brain are affected, right? Makes complete sense. So if the area of the brain, you know, your prefrontal cortex, for example, you might have a problem with concentration, right? And so it just depends on wherever you got injured is going to be whatever part that regulated, that's going to be usually where the symptoms come out. And remember the different sides of the brain, they have that cross in that middle of the brain there to where the left side of the brain controls the right side of the body and vice versa. And so strokes in the left side of the brain will affect the right side of the body, and vice versa, right? So don't, just make sure for testing purposes you get that straight, and for life purposes, I guess, too, career purposes, so that you right, so you got to flip them. And there's all these like little sub things as well. There's also brainstem injuries, but we're not going to talk about brainstem really that much. So hypoxia, right? So this is just not getting enough oxygen to your brain. A condition in which there's a decrease of oxygen supply to the brain even though there's adequate blood flow. So your brain is one of the most oxygen consumptive organs of the body. And so if you have low amounts of oxygen levels, your brain's one of the first things to get hit. The causes are supposed to reduce atmospheric pressure, carbon monoxide poisoning, or severe anemia, a failure of the lungs, right, to get the oxygen to your brain. So brain cells are sensitive to oxygen deprivation and begin to die within about 5 minutes. I have a friend from high school that got, he like fell out of this hunting blind and then didn't have oxygen for like 3 minutes. And then came back. It was a big drama for like a couple of years. I had a friend, more of like an acquaintance. I wasn't really super close to him, but a lot of my friends were friends with him type stuff. He was a grade above me, but I haven't checked over a while, but he had to like deal with this whole. It was just like 3 minutes without oxygen, and his whole life just got changed. So he started having memory problems and all kinds of stuff. But yeah, very, very impactful. When hypoxia lasts for longer periods of time, it causes comas, seizures, and even brain death. Right. So we have strokes. We have two major different types of strokes, and that is ischemic stroke, and hemorrhagic stroke. So ischemic stroke is where you have ischemia, you don't have proper blood flow to different parts because of a blockage. This is typically a blood clot or an embolus, where it just blocks the blood flow, and so because that you don't have blood flow, and because you don't have blood flow, you don't have oxygenation of certain parts of the brain, and whatever that part is of the brain. And we'll see next slide. Oh, just wait. You also can have hemorrhagic stroke where you have blood flow to the brain, but there's like a vessel damage to where there's a ruptured blood vessel, and because of the rupturing of the blood vessel, it's all on the outside, and it's not moving the blood to the proper spots, and there's a buildup of like blood in the brain. And so again, you're not getting proper oxygenation to the proper response. So when you do have this ischemia, what typically there's typical blood vessels that get blocked, and we know where those blood vessels are leading to. And so you have typical spots that if you have an ischemic, or if you have a blockage of the blood flow, there's like spots you look for, and they're kind of highlighted here in this picture. I don't know, you might be able to see it better on your computer than. You can kind of see them. It's these like dark regions, upper right, upper left, bottom left, and then the middle there. And so not all these spots always get hit. It's very variable. It might just be like one spot that you might be looking for, but those are the 5 main spots that where if you have ischemia, those are affected. Oxygen and glucose, admittedly, blood flow. You don't get proper glucose, which is the only energy source that your brain can use. Cerebral ischemia can be focal, as in a stroke due to cerebral artery occlusions, or global, as in a cardiac arrest. So you have these border zone regions in the brain where the tissue is furthest from the artery supply. So that's why this is the furthest from the blood supply, and so when these get blocked, they don't travel that well. Watershed area is what they're called. So with hemorrhagic stroke, that's when blood vessels in the brain ruptures or leaks in the brain cause uncontrolled hypertension. And it makes sense considering all of the peripheral blood artery disorders that we talked about. So heme and hemoglobin causing death and oxidative damage to brain cells. 10 to 15% of all stroke accounts for high mortality and morbidity. So it's not the most frequent of things are hemorrhagic, but it is the highest mortality. So it's like the most dangerous, but not the most frequent. 50% of deaths occur within the first 2 days. And at 6 months, only 20% of patients are expected to be independent. So very problematic. There's also this excitotoxicity, a condition in which the neurotransmitters become pathologically high, resulting in excessive stimulation. Excitotoxic injuries range from acute events such as stroke, hyperglycemia, or hyperglycemic injury, trauma, or to chronic degenerative disorders. So this is your MDMA, and so your excited neurotransmitter NMDA and AMPA, glutamate as well. And what these are going to trigger is just an influx of calcium, and then that will open up voltage-gated ion channels, and so it just causes this whole downstream effect, and which it just excites the neuron, right? And so that's where you get excitotoxicity. So cerebral edema, we talked about edema a lot. So we talked about where you have the pressure from the blood vessel comes in, and then it's very high in the arteries, and so it squeezes out all the stuff and bathes the organs. And we talk about the colloidal osmotic pressure bringing everything back in. Well, with brain swelling, you have an increased amount of fluids in the brain. The brain's a little bit there's this blood-brain barrier that a lot of people talk about. So there, it is a little bit different. Oh, it's right here. Vasogenic edema is defined as an extracellular accumulation of fluids resulting from disruption of the blood-brain barrier and extravasation of serum proteins. Yeah, so we talked about how in the capillary beds with blood pressure, not all proteins leak through the capillaries out into the interstitium, but the brain is even more selective in what goes out of those blood vessels, and it creates this blood-brain barrier. And so if you do have an extravasation of those serum proteins, and we talked about this in the edema lectures, if you just have a leakage of everything out into the area, that's one of the causes of edema, because the hydrostatic pressure is just so high that everything's getting in, and so these serum proteins can have neurological deficits and disturbance in consciousness, severe intracranial hypertension. There's also cytotoxic edema. It's characterized by a cell swelling caused by intracellular accumulation of fluid. So one thing, I think a big difference between the edema lecture that we talked about and then this slide right here is that with the edema lecture, we talked a lot about like it happening in like the thorax or like localized spots. And the thing is, your skin, right, is very elastic. It can move outward very easily. So if you have edema and you have the swelling, like it's a problem. I mean, we talked about all the problems, but like it has room to move out, and then we can like fix it pretty easily. This is all contained within a skull, right? And so not only is that problematic because you got to like have to relieve these, it's not as easily accessible because you got to go through the skull to like relieve this pressure. There's different ways, but then additionally, there's no expansion of the skull as easily as the skin. So this swelling is very much problematic, and it causes a whole bunch of like problems because the buildup of pressure affects all wherever that pressure is within the brain. It affects those localized areas. It can cause like headaches and all kinds of stuff. Leads to damage of neighboring cells, major changes in cerebral function, necrosis of brain tissue, stupor, or comas. So severe stuff. We also have head injury. So technically, a head injury is just any tissue to any area within the head, which includes the skull, the brain, or scalp. So even cuts on like your skin on your forehead is technically a head injury. But there's definitely different levels of head injury caused by different things. So most of the causes of head injury are from trauma, mostly things striking it. So this would be, car accidents, bicycle crashes, battlefield trauma, sports injuries. We talk about CTE a lot in football is like a big thing in NFL and high school football levels, even elementary school. But falls and then also assaults. So anything that's like causing that trauma or hitting it. This is a cool little this is a cool video about how, so this is an anatomically dense brain right here, to where like that's the consistency of what your brain is, and that's like you can see how hard this dude is striking this head. You can see how much the brain moves. So it kind of is a testament to how easily a brain injury can occur if those cells get damaged, because you see how much movement there is here. But then also kind of a testament also to how sturdy your brain cells are, and that like that's not a very hard hit. And most of us can like get hit by that like this hard, and then we're probably fine. But they're also all very much different levels of concussions, and so it's all very sensitive, but tough at the same time. Now, the one problem with this video is that it doesn't account for the cerebral spinal fluid, or sorry, any of like the fluid coating the brain that kind of keeps it at bay, and the rest of the skull, to where it's like the brain doesn't actually probably move this much. You can even see that like part of the brain is going over the skull whenever he hits it, and so it's like obviously that doesn't happen. So I mean, take this little video with a grain of salt. But what I do want to get at is that the brain, slight movements, slight amounts of trauma can cause traumatic brain injury. And with this, it's been very inconsistent, but it's a non-degenerative, non-congenital insult to the brain from an external mechanical force or trauma. And it can be closed versus penetrating. You missed my whole spiel.
I'm sorry.
Well, it'll be on the video if you rewatch it. So it can be closed where it's like you just have trauma where like this, where you just hit your head pretty hard, or you can have open or penetrating rather, that it goes actually through the skull. And then
So that's what a concussion looks like?
we're about to get to concussions. We haven't did that yet. But that amount of force can cause a concussion, though. Yes.
What about the what is it? The boxers get Parkinson's for boxers?
CTE maybe.
CTE.
Yeah.
Well, that's what football players too, right?
Yeah.
Yeah.
Well, boxers get that too. I don't know if that's what you're talking about. I don't know the relationship of.
I just thought of Muhammad Ali. Like shape and stuff. That could be partially due to like the hair.
Brain stuff.
Yeah.
Yeah. Believable. Again, I just haven't heard of it. So a concussion. What a concussion is? It's a clinical syndrome characterized by an immediate and transient alteration of brain function, including alterations of mental status, the level of consciousness, resulting in mechanical force or trauma. So concussions obviously are just anything that like hits you and it affects your consciousness to a certain degree. Now these can absolutely range from mild to severe, and so that's why you don't want to be like. You don't want to, if you do have a concussion, you don't want to be straining hard after you get a concussion because that just overworks the brain as it probably wants to recover. After getting concussions, it's a good idea maybe to either do lightly mentally taxing events or take a small nap or something like that. There's this whole myth about not sleeping after concussion. From what I've heard and seen and talked to like people who are in this area, I think that's just a straight up myth. To where, I think it's a good idea to take a rest after you get concussions. Which makes sense. I mean, I don't know. Wait, what? Okay. But a lot of these mechanisms, right, are not understood very well. Still, active area of studying. Have y'all heard of this guy, Phineas Gage?
Yes.
He had a thing. Yeah, like Oh, gotcha.
And then like his whole mood like changed or whatever because it did.
Yeah. Okay. All right. Well, then I won't go over this.
Yeah.
It's just a crazy story. Yeah, he lived for 12 years though. After that.
He lived 12 years.
Yeah.
Oh wow.
Oh, y'all didn't talk about that one? Yeah, he lived.
We go too deep. Like we just talked about how like it punctured his frontal lobe or whatever, so it caused like a personality change.
Yeah, and it did. Yeah, that's well documented. But he lived for 12 years after this. He had to like switch jobs though because I think he was like he like joined the circus. I think after this too. I don't know. There's this whole. I read the whole Wikipedia page like 6 months ago, but I forgot most of it. But just crazy how much brain damage you can have without anything. There's also another thing that there's like people with brain tumors that get like a large chunk of their brain just removed, and they have like small losses in IQ. That's like almost negligible. The brain's just a crazy area because we always talk about how each little piece and part is so important. So you'd think these injuries would just, and most of the time they do, admittedly. I think there's just rare exceptions. Like there's not a lot of people who get shot in the head and then like live. You know what I'm saying? But just a crazy story. But we won't go over all of the ins and outs here. So with traumatic brain injury, the most common cause of disability and death in America under the age of 40. Wait, didn't we? Okay, maybe not. So it's not visible always in imaging, so it's not the easiest thing to diagnose, and there's no current treatments. Many instances are unreported, so it's hard to really get statistics about really what's going on. The primary reason to report TBI is to look for a brain bleed, which is potentially deadly. So that's a very important thing that people need to get to the hospital for. So there are two different types. There's primary and secondary. So this is very similar to the spinal cord injuries insofar as when you have primary, you have external lacerations, skull fractures, contusions, cerebral lacerations, diffuse axonal injury. But with secondary, it's like it's because of things that cause this stuff. So inflammation, hypoxia, increased pressure, hypotension, release of toxins, synaptic dysfunction. I think that's pretty intuitive with regard to primary is just like directly affecting the brain, while the secondary is these it's like a result of something else. With there's also focal versus diffuse here. We have focal brain injuries, the typically associated with blows to the head that may produce cerebral contusions and hematomas. While diffuse may occur in the absence of impactful force, but is dependent upon inertial forces that are complement. So what we're getting out here is that like this is the difference between getting punched by a boxer in the head and getting in a wreck where you're like jolted really, really quickly. That's not like technically a direct impact, but it's like your inertia was continuing and then you were janked back because you got in like a car wreck and stuff like that. Falls, assaults. And this can be acceleration and deceleration or rotational problems. We talked about that a lot with spinal cord because your neck is more like your spinal cord behind your neck that's more affected by this stuff, but rotational forces also affect your brain, right? Or acceleration, deceleration, stuff like that. And so they affect the neurons of the brain. So most traumatic brain injuries are mild. Closed head, frontal impacts, in which the brain undergoes both lateral and rotational. Yeah, the thing is that like our reflexes when we get hit, we like jolt our head to the left or to the right, like, and so you have these like rotational forces whenever you get hit. It's like it's all nuanced. Regardless, you can have focal or diffuse injury patterns from both, so you just need to monitor whatever it may be. So these also damages the axons themselves. So you can see here, this picture is really good. That it's just like you're severing that connection between the axon and the dendrite. And it's a very important pathological feature in traumatic brain injury because not only do you damage the axons, but you also damage the blood vessels that feed them. Characterized by axonal damage that's widely distributed in the cerebral hemispheric white matter, including the corpus callosum and the upper brainstem. Leads to functional cerebral impairment ranging from confusion to coma and death. So with a concussion, there are different versions of it, but with mild concussions, these are a lot of the symptoms here, where you have headaches, head or neck pain, loss of balance, vision disturbances, dizziness, and fatigue. But while severe ones accounts for about 10% of cases, that has more of an effect on your brain, where you have slurred speech, profound confusion, seizures, coma, persistent headaches. Obviously, the more severe the traumatic brain injury, the worse these symptoms are. There's this Glasgow Coma scale to kind of measure how bad a concussion is, but at this point, it's been pretty thoroughly shown that it doesn't correlate with how bad the concussion is with regard to how these work. But what people do is they'll do this like they'll do these various tests and then they'll give it a range from 0 to 3. So the lowest score that you can make on these things are a 3, but that's very bad if you can't do a lot of this stuff. But again, it doesn't correlate very well. But I had a student last semester tell me that like they still do this in the hospital, even though it doesn't correlate with how bad the concussions are. So you might still see that, I guess. When alcohol's around, these traumatic brain injury is more common. So studies estimate between 30 to 50 of patients treated with TBI are intoxicated at the time of injury. This ranges everything from people driving drunk and then getting in car wrecks to people doing like dumb stuff and getting in bar fights. And so because you're in a fight, you got punched in the head and got a concussion from it.
I was
So
actually about to say that the previous slide, this girl that I went to school with, her boyfriend died in March because he got in a fight at Tiger Lane and he was drunk.
Yeah,
And I
it's
guess he
actually
fell
probably
and hit his head.
I'm sure that's happened a couple times over the years.
Yeah, especially at Reggie's, it goes down over there.
Yeah, just all of them. I don't know. I guess Reggie's is like the freshman, so it's a whole bunch of cocky people. They just got
Yeah.
So whatever. Well, Reggie's isn't open anymore. Huh? Didn't they close it down? I thought they heard it closed it down. Yeah.
Well, it was like the parking lot.
Yeah. Okay.
Yeah,
So just all of Tigerland.
Yeah.
We don't have to localize it to a bar. Regardless. Yeah. So that's a very common thing. And then also whenever people are alcohol affects your brain in a manner to where it's metabolite ethylaldehyde is directly just toxic to neurons itself. So it also you're weakening your brain at a molecular level as well. So they're more susceptible, and then additionally on the flip side of that, they're more susceptible to the effects of alcohol, to where they're at greater risk of developing alcohol use disorders, which I think we're not going to talk about. I think that's one of the lectures I eliminated this semester. But yeah, this is where you just you have like a dependence. It's like an alcohol addiction type stuff, but I don't think that's the PC way of saying it nowadays. So people with traumatic brain injuries can also develop binge-like drinking habits, even in the absence of other insults, and it induces neuroinflammation. Sustained neuroinflammation leads to cognitive dysfunction and neuronal damage. So not only do people who are perfectly healthy get more traumatic brain injuries, but also after people get traumatic brain injuries, they are more susceptible to developing alcohol use disorders. So it's kind of both ways. It's bad. We'll just skip this slide. This is silly. And we'll just go to Alzheimer's disease. So Alzheimer's disease is just problems with memory and thinking as people get older. I think a lot of people have been exposed to this to a certain degree. Symptoms develop slowly and worsen over time, develop over 5 to 15 years after old age. When people get to old age, many patients experience behavioral and personality changes, depression, insomnia, delusions, and hallucinations. So yeah, the risk development of Alzheimer's disease under the age of 65, 4%. But I think that's even like people who are like 60. It's like, yeah, you're under the age of 65, but you're still up there. There's not a lot of 20-year-olds developing Alzheimer's disease. And then they increase as you get older up until you're 85, and probably at this point you're just like there's a plateau there because either a lot of people don't live that long, and then if you do live that long, you probably won't develop Alzheimer's disease because of either the nutrition you consume on a daily basis, which lower your risk of Alzheimer's disease, or other lifestyle factors, we'll say. All right, brain alterations. So the classic story with this, and we'll talk about the problems with this a little bit later, but the classic story is that there's a buildup of these amyloid plaques that these amyloid precursor proteins that self-catalyze to form beta amyloid plaques, and these beta amyloid plaques build up in the brain, and then block signaling, and you can see these beta amyloid plaques in microscopy and they run weird on a Western blot. I think that's a Western blot at least. Maybe not. I don't know. Regardless, you can see these things on in microscopy, and they build up, and they're just gunks of protein that then just clog up the whole system. Now, this whole story, though, has really been called into question. We'll see this later. It's really been called into question because apparently the dude that discovered this, he falsified some data about this whole discovery, and so I don't know if all of this is thing, and that kind of sets everyone behind the ear because like studies have been funded to be like, well, how are you going to know if they have Alzheimer's disease? And like, oh, we'll monitor the beta amyloid plaque formation, and then okay, here's $1 million, go do your research, and then that person spends 5 years because they're going off of some research that they thought was legit, but it's all falsified. So it's all it sets people behind when people do this stuff. But so this whole story might be just complete bogus that we'll find, and we'll talk about maybe the real cause of it in a few slides. But what is true about Alzheimer's disease is that you do have these neurofibrillary tangles, and you have this buildup of this tau protein that would, in this helical fashion, and there is a brain atrophy as well that occurs. The resistance to chemical enzymatic breakdown and lead to failure of transport system. You have, and you also have enlarged ventricles. So yeah, part of the Alzheimer's disease is that you just have just a worsening of what the brain function is at that level. You can also see in brain scans, you can see a normal healthy brain, but then in an Alzheimer's brain, you can see that there's these like massive just gaps in between the folds of the brain, and there's loss of volume in the gyral volume. But so this is what we're talking about with the atrophying of the brain. You can start to see this in when you take pictures of them. Dilation of the ventricles. Yeah, so that's what an Alzheimer's brain looks like. In patients with Alzheimer's disease, plaques and tangles are found throughout the neocortex, in the hippocampus and amygdala. The functioning is so this is kind of looking at mechanism here. The hippocampal functioning in particular may be compromised due to the pathological changes, since it's crucial to information processing and acquisition of new memories. People who get this part of the brain removed they just can't form new memories. I'll skip the story for now. I'll skip the story there to speed things up. But Alzheimer's disease is associated with decrease in choline acetyltransferases, responsible for the synthesis of acetylcholine, which hopefully y'all remember from physiology, the importance of that neurotransmitter, and activity in the cortex and hippocampus where we form these memories. There are other gene markers associated with it, but again, it's just brain research is hard, and this is even harder because Alzheimer's disease is hard to model, and it's older populations that get it, so it's kind of hard to study, but they do see some gene markers which would be helpful for diagnostics if we can really get those fleshed out. With these diagnoses, there's hallmark symptoms: loss of short-term memory, obviously, and denial of memory loss because you just don't remember that you have Alzheimer's disease, eventual disorientation, impairment. And so what you can do to diagnose is just do this cognitive screening, try to look at memory, calculation, disorientation, and communication abilities, and if those are impaired, then you can diagnose Alzheimer's disease. You can look for underlying infections. We'll talk about that next slide, or in a couple slides. And other medical conditions for elimination purposes. True diagnosis is only possible, though, post-mortem. So there are different stages of Alzheimer's disease that y'all will not need to know for the test, but here they are regardless. They it can range from mild to severe, and it depends on which areas of the brain are affected. Treatments, there are different drugs. Again, y'all don't need to know this. So y'all can, but there are also non-drug approaches, changing the environments to resolve challenges and obstacles to comfort. And understanding the meaning of challenging behaviors whatever. Yeah. So that's so what we're starting to maybe see is there's a big study that came out like 2 years ago, and what it found was it was a correlation between herpes viruses and Alzheimer's diseases, and they're starting to think that maybe that Alzheimer's disease is actually caused by this persistent viral infection. So again, this is the virus I study, or the class of viruses I study. So it's that same class of HCMV and HSV that we talked about, and STDs, and it causes miscarriages. But they think it's these viruses that, because they establish latent infection in neurons, that these latent infections cause later on Alzheimer's disease. And apparently, like, the numbers correlate pretty well, and it kind of makes sense. But again, this is so new. This is only like 2 years into this research, so we need to do a lot of work to really see if that's true. But it could be this varicella zoster that's the causative agents of chickenpox and shingles, and then these herpes simplex viruses. So maybe one of the treatments for Alzheimer's disease might be vaccinating against herpes viruses. But that's another challenge, because herpes viruses are also very hard to vaccinate against because of a lot of stuff. But because of the persistence of the virus and its ability to shut down the immune system. But you don't have to know that. And then this is talking about a lot of some studies about the tau protein, but this is the slide about how there might be a scandal in the Alzheimer's world where this stuff is or some of the tau protein stuff is made up. And so researchers really got to flesh out whether or not what's going on with Alzheimer's. But at the end of the day, it's very much a problem that should probably be addressed eventually, because it affects people emotionally in a lot of ways and causes a lot of problems. But that's it for this. We'll end early today, and y'all can get to studying. Any questions there?